My name's Daryl Corder, and I am the director of our residential substance use disorder programs and our MAT services. On campus, we have 5 different SUD programs, which is really exciting. All the way ranging from starting at detox, all the way up to a 12 to 18 month recovery resident sober living program. I'm going to first start with talking about the different programs. So we have a ASAM 3.7 detox center. This is a small 8-bed unit, and the primary focus at our detox unit is it's a voluntary service. So no involuntary admissions, no 1013s, or anything like that. But it really is the focus on the medically monitored withdrawal management. So folks who are coming off of alcohol, benzos, opioids, whatever the substance is, who are really experiencing moderate to severe withdrawal symptoms and need some medical stabilization before they can really start their treatment experience. So we've got a detox unit here on campus. And you're going to hear me say up the hill and down the hill, because basically we have 7 acres here, and it kind of starts at the top of the hill and then you work your way down the hill. So after detox, folks kind of go up the hill a little bit to Grand. Grand is our 28-day intensive residential addiction treatment program. And the primary focus here is on doing the treatment work. So it's the group counseling, group therapy, individual counseling, case management aspects. It's 28 days intensive residential. Clients are here spending probably 4 to 5 hours a day in programming, and it really is where folks can get the early foundational recovery skills, so that to help them make a beginning, on their treatment journey, on their recovery journey. Folks graduate Grant after 28 days, and if you say, hey, I don't have really supportive, stable housing when I leave here, this 28 days has been really helpful, but I really want to continue my work. Well, we also have the 12 to 18 month program. So someone who graduates Grand can then walk halfway back down the hill to and we have 12 apartments back here, right behind Grand. It's kind of in between Grand and our detox unit. And it's really a semi-independent residential treatment style. So think apartment style living. We have 15 beds. Clients are still involved in 12 hours of clinical services weekly. And they're also at the point where once they get through the first phase of treatment, folks start, applying to jobs, putting a resume together, becoming gainfully employed, pursuing, work, educational goals and things like that. And the emphasis there really is on returning to work, school, and engagement in the community. So once someone graduates that program, there's an opportunity for transitional living, because someone who completes the semi-independent program may still need just a few small supports before they can truly transition into full independent living. And we also have 2 of our units dedicated to transitional living. The next piece that I'll share with you with our continuum of care, and this is the newest aspect for Viewpoint Health, is now we're starting to incorporate MAT services. So think medications for addiction treatment. Formerly, you used to hear medication-assisted treatment. And now as there's more the kind of recovery-focused shift and being more intentional about destigmatizing things. The language is medications for opioid use disorder or medications for addiction treatment. And what is newest for Viewpoint is we have 2 MAT pathways. One is a Vivitrol pathway, and then also a buprenorphine pathway. So for individuals, think with more moderate to severe opioid use disorder, now they can start receiving the medication buprenorphine, think Suboxone, Subutex, and not just be on it briefly to help detox, but also be on the medication maintenance. Because what we know now, the gold standard in evidence-based practice is medications for addiction treatment. And that is the newest kind of service provision that we have. And the way that we've envisioned accessibility to these medications is that MAT isn't necessarily its standalone program per se, but it's an adjunct and supplemental service that clients who are in our care can access MAT services, whether they're at our detox unit, whether they're at Grand, or the 12 to 18 month program. And then for some individuals, say, who aren't connected to one of those residential programs, they can still connect to MAT services through our outpatient clinics.
My name is Dakota. I'm an addict. I have 16 and a half months clean. I started using drugs when I was 11 years old. It was pills, and it progressively got worse. So the age of 14, I was smoking crack. 15 turning 16, I was shooting heroin, IV drug use. And from the age of 16 to 23, I spent every one of those birthdays locked up. Every time I ever went to jail, which is 32 times. Okay, I have 7 felonies. Every time I ever got locked up, I would always believe in my heart that I was done using drugs. And I would really believe that until I got out. And I'd be out for an hour, 2 hours. And here I am doing the same old things. And that's just the way I live my life. Hurting people, hurting myself, hurting my family. Like today, I'm just grateful for what I've gained since I've been here. Which like I almost feel like I've gained like a piece of my childhood back since I've been here. That's what the people here have given me. Which is weird to say, you know. But I've had a job for over a year now. I've steadily worked my way up in that position. I just try to be the best person I can be today. And that's only possible because someone else believed in me when I didn't know how to believe in myself. And those are the people here. Those are the people here. I would like to stay as long as I can. I would like to stay a few years, 3, 4 years. You know, not forever, but at least until I can really, really get everything I can get out of this program. And 28 days wasn't long enough. I don't even think 18 months is long enough. If you're an addict like me, it is a beautiful, sad story of addiction and recovery. I wouldn't trade it for the world. I would not trade it for the world.